Welcome back, my dear sisters and maybe brothers, your family. Welcome back to our Being Woman series, Health for Women. And I am so excited to share. As we go on, the topics become more interesting and more difficult to to explain. But by God's grace, we will still be able to go through all these and learn something so that we can become better women that will serve the Lord. So the topic, we are done with part 1, part 2, part 3 of menstrual abnormalities. Now we come to one topic that is very, very common, and we call that endometriosis. Now, endometriosis is a very common problem. Actually, it is more common than people think. I have patients that when I used to have patients that when I did a C-section, they have endometriosis. When I see in the pelvis, they have it, but they didn't even know, and I didn't even notice. But they were having painful menses, and we thought it was just run-of-the-mill hormonal problems or physiologic dysmenorrhea. But really, when we had C-section, we noticed that she had it. She had endometriosis. So endometriosis is the presence of functioning endometrial tissue or implants of endometrium outside of the uterine lining. So you remember that the lining of the uterus that sloughs off every time you have menses is called the endometrium. And because it is the lining of the uterus, it's got to line the uterus inside the uterus, because that's where, when it grows and waxes and wanes and goes out, grows and then wanes and goes out, this is where the egg is supposed to be planted. That's why it grows, because it becomes like a cushion that the fertilized egg comes and embeds in it and grows. But if it goes outside of the uterine lining and it is functional, meaning it responds to the hormonal changes, and it is outside of the uterine lining, implanted outside, then you have what you call endometriosis. Can you imagine? When you have normal menses and it sloughs out, it goes out, okay, through your cervix, and then it goes out of your body. But that happens that it grew because of your estrogen, and then the ripening because of the progesterone. And then you didn't have a pregnancy, it comes out. But if it were implanted outside of the uterus, it can be functional still. In other words, it is listening to the hormones, okay? So ectopic, it's outside of the uterus, out of place, okay? And it's functional, meaning it responds to hormonal effects. So endometriosis is the presence of functional endometrium tissue or implants of endometrium outside of the uterine lining. Normally, this is the lining here of the uterus, okay? Normally, it will come out in menstruation, okay? And then it starts growing when the ovaries secrete estrogen and the lining starts growing. Then a follicular phase, or the growing follicle, releases estrogen, and this one starts growing and ripening for a pregnancy. And then in the luteal phase, where the egg was already extruded, ovulated, the one that remained back is the corpus luteum. It releases progesterone and it ripens and makes it ready for a pregnancy. But if there's no pregnancy, it will just slough off in menses. But if this lining here is outside of the uterus, outside here, that is ectopic, out of place, okay? But it responds. It is functional. It responds to the hormones. That's why it will grow like it should have grown here, but it's outside here, okay? So when it's time for menses to come and it's outside here, it's going to plump up and it will bleed, okay? So you're bleeding outside here. And so when you have this functional endometrium outside of the uterus, the lining outside of the uterus, and it bleeds during menstrual period, this is not normal. There's no blood in the pelvic cavity. But because these things are functional, it bleeds. And so you have accumulation or pooling of blood in the pelvic cavity outside of the uterus in your pelvic cavity, and it causes irritation, and therefore you have painful menses. Let's go forward and study some more on endometriosis. So, endometriosis, the common places of implantation. It's in the ovaries, the fallopian tubes, uterine sacral ligaments here, the ligaments here, and the abdominal cavity. You see, common sites. Outside, so it can be implanted anywhere outside your cavity, outside your uterus. So you have some in the ovaries, you have some in the fallopian tubes, you have some in the uterine outside, like that. And they cause adhesions. So they stick to each other because inflammation is present. So premenopausal women, those who are almost to menopause, are most affected, especially those in the third decade. So when you're about 30 years old, you become more prone to endometriosis. Now, endometriosis is one of the manifestations and one of the causes of painful menses. 50% of women with pelvic pain, infertility, or a pelvic mass, because the blood accumulates outside of the uterus, and it causes dysmenorrhea, and there's adhesions. So you can kink the fallopian tube gets kinked and in areas here, and it closes the passageway. So the egg cannot go there, the sperm cannot come in here because this tightening of the space in the fallopian tubes. So you can have infertility. And if it accumulates here and accumulates and accumulates, then you would have a pelvic mass. And we call that the chocolate cyst because the blood that accumulates become like brownish, like chocolate. So they call it the chocolate cyst. It's a pelvic mass. It's minor. It is usually benign, but it can become malignant. So it is a third leading cause of removal of the uterus or hysterectomy. To remember, the first cause is abnormal uterine bleeding. We will talk about the second, but this is the third cause of uterine removal, as hysterectomy is ectopic pregnancy. Ectopic location of the endometrium. There is a greater risk for ovarian cancer. Yes, because this lining is out of place and it listens to hormones. It is functional. And if your lifestyle is bad, it's out of place, it's inflamed. The cancer develops very frequently in inflamed areas. Because when there's inflammation, there's lots of inflammatory stuff in there, and it's very easy for the dividing cells to become mutated. So this endometrium out of place is prone or can become a cause or an increased risk for ovarian cancer, because if it's implanted in the ovaries. So we don't want endometriosis. Some more on endometriosis. What is the pathophysiology? So how does it come about? How does patho means disease and physiology is how it happens or how it functions. So pathophysiology of endometriosis, the exact cause is not known, although there are multiple theories. So many theories about it. The most commonly accepted cause is retrograde menstruation, meaning the fluids move through the fallopian tubes into the pelvic cavity. Okay, usually brought about by the obstruction of menstrual flow. So the cervix here is supposed to open. Okay, when the cervix open, and it's enhanced when you are relatively relaxed. Because when you relax, you're in the rest and relax, and that is parasympathetic nervous system control. So when you relax, your cervix relaxes as well. When you're stressed, your cervix is sympathetic. There's no relaxation, so your cervix is like constantly contracted. So if your cervix is constantly constricted, it does not relax because you're very, very stressed. Then the blood that's supposed to come out, the endometrial lining that is supposed to come out through your cervix, goes back flows through your fallopian tubes out into your pelvic cavity. So let's say I'm the uterus with my lining inside, and my fallopian tubes are like this, okay? When my cervix is not allowing the blood to go down and be outside and taken care of out there or discarded, instead of going out that way, it goes out into the fallopian tubes and is implanted out here in your pelvis, where it's not supposed to be. So what are the things that cause problems of your cervix not relaxing when it's supposed to relax? Remember, sister, one of the major problems that we have in HPO axis and UE women's problems is stress, okay? Because the stress closes the cervix. It does not relax this. It causes the cervix to like this, okay, instead of relaxing. So the blood goes back into the fallopian tubes, into your pelvic lining, pelvic cavity, and will grow there every menstrual time. You bleed every menstrual time. It accumulates, becomes a mass, and can become cancer. You don't like this retrograde thing. So we have to be careful before menses. Take care to be relatively relaxed, relatively stress-free, so that your cervix opens. You know, I remember when I was younger, when they were given hyoscine something medication, it relaxed the cervix. And when I took the Buscopan, the name of the medicine was Buscopan, it relaxed the cervix. And then when I took that, boom, comes out my what they call this, my endometrium. Now, the endometrium is like plastic. So I was taught in grade 6 by our teacher. She said, when you have menses, you look at your pad and you do this on your pad and you check. And sometimes it's just blood clots. But sometimes you can get the cellophane-like lining of your uterus that was sloughed off. And yeah, when I was having this thing, it became a habit. So I know when I have severe pain, I know there's the cervix that is not allowing, and I took the Buscopan, it would relax, okay? Now, Buscopan is one of the ones you take the medication. It relaxes the cervix and allows the endometrium to pass, okay? So that's one of the things. But we're not going to be using that one all the time, because we have a problem when we do take medications all the time. Well, if you have ectopic tissue out here in your pelvic cavity, it's not supposed to be there. And your body knows that when you have ectopic stuff in your body, you have ectopic, it's not supposed to be there. And your body says, oh, I don't know this. Endometrium is not supposed to be in the pelvic cavity. Endometrium is supposed to be inside the uterus. So what does your body do? This is a foreign object in your pelvis. So it says, let's have war against this endometrium tissue. It's not supposed to be here. Inflammation comes about. When inflammation happens, fibrosis follows. After you have inflammation, there will be scarring, and fibrotic scarring. Then you would have adhesions. Remember that the fallopian tube will change position, and it will change the passageway of the sperm and the egg, and you can have problems with that, infertility and ectopic pregnancy. And then you have pain, okay? And you can have infertility, and you can have ectopic pregnancy. Ectopic pregnancy means a pregnancy outside of the uterus. Problematic. The uterus has been created, made for the baby to be inside. But then now, because of the problems of your endometriosis, the baby was implanted outside, and then it's not going to grow there. It's going to die. Most of the time, more often than not, very rare pelvic pregnancies, and they are emergencies, really life-threatening. So you don't want ectopic pregnancies. Then you have what you call accumulation and encapsulation of the blood in there, that I said, the chocolate cyst that can become cancer. You don't want those kinds of stuff in your life. Okay, so what are the risk factors? What are the risk factors? You don't want ectopic pregnancy, right? You don't want. So we have the risk factors. Okay, they found out that women that have always having menses, never getting pregnant, never given birth, never had 9 months of respite from menses are more prone to develop endometriosis. And it's starting your period at an early age. So we remember that we do not want to start menses early because of the repercussions of early menses. Early menses, the more you menstruate. So if the little girl starts her menses early, it makes her prone to have endometriosis. And then if you have long menses and you go into menopause long, like I have some friends that are not menopause, they're already mid-50s. Regularly, we go into menopause like somewhere late 40s or early 50s. But this one prolongs and prolongs. Usually, I don't know whether I can really say this one, but we take into consideration that if you menstruate early, you're going to menopause late, sort of like that. So you're already prone when you menstruated early. You're going to be more prone because you're going to be menstruating at too late. So going through menopause at an older age makes you prone to endometriosis. Okay? Then you have short menstrual cycle. For instance, less than 27 days. So if your menses are close together, you might be able to deal with the ectopic occurrence of ectopic endometrium outside of the uterus. Okay? So short cycles. Heavy menstrual periods that last longer than 7 days. There's a chance that the endometrium will go out of place. Having higher levels of estrogen in your body or a greater lifetime exposure to estrogen your body produces. So you really need, that's why it's nice to have regular menses, normal menses, because all these things out of the normal increases your risk of developing problems later. Okay? So these are very common actually. And if you have a low body mass index, okay, this low body mass index are those that are very, very thin, those thin ones. So you have a problem when you have when you're fat and if you're on the heavy side, and you have a problem if you're also very, very thin or very slim. You get problems there. If you have one or more relatives, mother, aunt, sister with endometriosis, it also is familial if not hereditary. Okay? So we have to be watchful for that. Any medical condition that prevents the passage of blood from the body of the uterus out into the endometrium during menstrual periods. So stress, the one that causes scarring of the cervix so that the blood cannot egress or go out that easy, can make you prone to develop endometriosis. If you have disorders of the reproductive tract. So all these, take into consideration, can make you prone to have endometriosis. The third cause of hysterectomy or the removal of the uterus. Now, let me go back to the low body mass index. It's very strongly associated, especially if at 18 years old. That's what they have in there, according to the Mayo Clinic in this website, Diseases, Conditions, Endometriosis. If your body index is low and you're 18, you will be most likely prone to develop endometriosis. Those are the risk factors we covered for our case. Now we come to common manifestations. So, endometriosis is something, right? I need to check. So what I will need to know whether I have endometriosis or not, right? So what are the common manifestations? Dysmenorrhea. It is outside of the uterus. It is causing irritation in the pelvic cavity. So you will have painful menses longer than the regular period because it's not normal in location. It sheds off earlier, and towards even later because it's not normal. And 25 to 40% of these women who have this dysmenorrhea, who have it, are infertile. So many of the people, of the ladies that came to me, we have to check whether they have endometriosis or not. Because many times they might be suffering from endometriosis and manifesting as being infertile. Because you remember, it can cause blockage in the fallopian tubes. It can cause kinking and or disruption in the flow of and the meeting of the sperm and the egg. So she can become infertile. Then there would also be excessive bleeding because sometimes however, in the growth of the endometrium, that it becomes sicker than it should be, and you would have excessive bleeding. Painful bowel movement or urination, because it depends on where this ectopic endometrium is implanted. What if what is implanted in your bladder? So when it's covering your bladder, is are scattered around your bladder or scattered around your your rectum. So when it will stretch, or when it will deflate, like when your bladder fills up, you're stretching it, it hurts. When your bladder becomes deflates, when you're passing out urine, it will shrink like this. And so this doing this of your bladder causes irritation, and it's bleeding. Okay, it's irritated, it's inflamed because you're having menses. It really hurts the woman to have endometriosis in the wrong places. Also, when you move your bowel, and the expanding and the deflating of your rectum, also the same way can cause inflammation and pain. And if this implantation is in the back to your sacrum area, you will have pain in the lower back. You might think it's, can you please massage my lower back? No amount of massaging in the lower back will because the pain is not from the surface of your back. No, it's not in your muscle, it's not in your bone, it's inside in your pelvic cavity. Then if it's implanted far away in the areas in your abdomen, you would have abdominal swelling and tenderness. Imagine that. That must be really painful. And okay, if it were implanted close to the cervical area, in the upper area of the vaginal canal area, then you can have the painful sexual contact. They call that dyspareunia. Painful menses, especially in the posterior sac of the beyond the cervix, that could be caused by endometriosis. And you have there's a small increased chance of pelvic cancer. I said, because this endometrium is not in the proper place. Inflammation is there. So when there's inflammation, it is the bed for mutation and cancer development. So small increased chance of pelvic cancer, especially ovarian cancer, if you have endometriosis. That's not good. You don't want that. So these are the things that are manifesting. So when you have this and you have this pain, you got to have yourself checked, right? Manifestations will sort of tell you that you have to get yourself checked. So how is endometriosis diagnosed? How do we diagnose endometriosis? Okay, a history of pain. They do a physical examination, and it hurts when they do a physical examination. And bimanual pelvic examination, and you move the cervix like up and down like this, you irritate that area, it hurts in pelvic exam. This should be done, and then it will sort of say you need to do an ultrasound or a CT scan or an MRI, and this will help you make the diagnosis of endometriosis. So what else can we do? That definitive diagnosis can only be made. Just it's hard unless you have big chocolate cysts. I did ultrasound. I was trained to do pelvic ultrasound for OBGYN, and I had an idea when I would scan the uterine wall, the muscles. Oh, there's blood here. And I scan the pelvic cavity. Oh, there's accumulation of the chocolate cysts. Especially the chocolate cyst has a certain consistency on ultrasound. Oh, she has this thing. So I have an idea. Then you can make the definitive diagnosis. Made certain by seeing and doing a biopsy and histology of the abdominal tissue. So, okay, I'm not quite sure. Let's do an operation and look. Or we can insert a laparoscopic tube, because that's really the definitive diagnosis. Laparoscopy is this one, minimally invasive. They have this tube here that they insert, laparoscope, and they look and they can see the chocolate cysts and the implants here. It is minimally invasive and can see the masses in the pelvis, and you can get your diagnosis, and you more or less have a certain diagnosis. meaning it is very important for us to get that diagnosis because there's a chance of cancer and there's a chance that you will have your uterus removed. Hysterectomy. We got to be proactive in doing these things because diagnosis is important always because we can have treatment. We can catch these things and deal with them so that we don't have to suffer from the deleterious effects, infertility or cancer or removal of the uterus later in life. You don't want that. Okay, so what can we do now? According to the Eunice Kennedy Shiver National Institute of Child Health and Human Development, these are the treatment or the management that we can get for our women and the factors to consider. So it's not the end of the world. When you have endometriosis, we can have it checked. We got to check it because, and factors to consider age, because the older we get, 30 years old and more, they're the ones that are prone to endometriosis and they can become infertile. They can suffer from dysmenorrhea. And also, if it's severe, the pain is severe, you got to see, you got to check because she might not just be having regular dysmenorrhea, she might be having really endometriosis. And then also for severity of the disease, it might be bad. It might really be bad. Check. And if she really wants to get pregnant, what if the tubes are kinked? What if she has adhesions? You have to deal with that. So if she wants to get pregnant, she has severe dysmenorrhea, check on this because it might be endometriosis. And however, there's no specific treatment. Options are to control pain and infertility. Because, what can you do? They're already implants. They cannot scrape this all. We should remember they can be functional. They can be stuck there. This endometrium can be stuck there and can be functional. You cannot scrape everything and remove everything there. However, if you don't want to get pregnant anymore and you want to become menopause, you can take out the whole reproductive tract down there and no more pain, okay? But there's no specific treatment. Options are only there out for you to control pain and infertility. So you can try your best if you really want to get pregnant to try to deal with this because it's very hard to get pregnant with this kinking and adhesions in the pelvic cavity. So you have to control pain. How to control pain? You also sort of like not have menses to become amenorrheic. No menses, absence of menses, so no growth of the endometrium in the area. No growth, no bleeding, no inflammation, no pain. Okay, so that's the hormone therapy management. And then if there is some pain still, then you take pain medication, pain medications for that. And if it's severe, of course, we have surgical treatments. Treat with surgery, remove the problem. If you have infertility, removal of the growths probably would help. Maybe you might help. But when you breach the abdominal cavity by an operation, especially if it were opening up for lap or abdominal lap, explore lap, open up and see. It's good now. There are many people who are already very well at doing laparoscopic management or diagnosis, and they can do very minimal invasion. But in the past, when we didn't have all training in laparoscopy, they would open up and take out these lesions. But when you breach the abdomen in a surgery, you're making even it prone further for further adhesion. So to remove all these, and then you scrape, you're leaving scar tissue open, and then you can have adhesions because of this scraping. So it's hard. That's why they opt to do the medical or the hormone therapy because it will die out. The body will take care of the scar tissue and kill the ectopic tissue. So they give you something. But then if you're not having menses, you make yourself prone to osteoporosis. So, if you cannot, you can choose which way you're going to suffer sort of in this world. But it's always an informed consent, whether you'll have pain or not, whether you can get pregnant or not, how sad endometriosis is. That's why we really need to deal with it. So many times when they want to get fertile, when they really want to have children, then they can have an IVF or in vitro fertilization. They would have a test tube baby implant in the uterus. That's many times the only way that they can really get pregnant if they had endometriosis. But it's so carry all these things saying, right? I don't like to hear this stuff. It makes me discouraged. But I am glad that I learned natural remedies. I really am so thankful to God that there are in almost, God really does not leave any stone unturned for our salvation in what? Our physical life or our spiritual life. So, yes, we can do something about it. There are natural remedies. However, I said, always will say, make sure that you have the right diagnosis before you start doing treating yourself, right? You can't just go ahead and say, I have pain, it's becoming severe. It's endometriosis. No, sister, no. Get yourself checked. Work with a healthcare provider always together with that. So you have to find a healthcare provider, a doctor who is into these things, and they're very far in between. It's very hard to find somebody who's going to do natural remedies with you, but there are. You got to find some of them out there. Work with a healthcare provider that's open to natural remedies. And many times they just, okay, you have pain, take pain reliever. And if you're dysmenorrheic, etc., anemic, bleeding here and there, I'll take care of the anemia. Symptomatic and supportive treatment. It's like not really going to heal the problem, but will help you from suffering. Okay? So, because there's inflammation, you got to do something that is anti-inflammatory in your diet. So, remember, there are foods that are anti-inflammatory, and there are foods that are inflammatory. All plant-based food are anti-inflammation. But if you cook it in high heat and you fry it and you refine it, or you complexly prepare the diet, you're going to make it inflammatory. So you have to eat your diet, your food, your plant-based food in the closest to natural form. And if it's that way, you have a less inflammatory or anti-inflammatory diet. That's what you do. Focus on anti-inflammatory lifestyle, your food, stress management, and as we said, we talked about the supplements. There are supplements to help you to manage your hormones or manage your lifestyle so that you're not so stressed, so that your anemia comes up, so that you get the enough nutrition that your body needs so you can fight inflammation in your life. Okay, moderate exercise. You know, this back bending and all those things like this splitting and gymnastic stuff. That will most likely cause you to have problems. So moderate exercise. And the best exercise, I think, is moderate brisk walking. Okay? As per Spirit of Prophecy. Anyway, moderate exercise is the best exercise for you. And outside in the sunshine. Okay? In the Central Valley here in California, in Bakersfield, I live in Bakersfield, the air is almost always polluted. I cannot really go outside in the sunshine all the time. I go out when there's a lot of negative ions in the air, like in the spring and in the fall, when there's a lot of negative ions in the air and the air is clear. I go out in the sunshine to get moderate exercise so that I'm anti-inflammatory and my body is in anti-inflammatory state. Again, plant-based diet, as I said. And remember the cold sits ice bath? Oh, this is really good. Prior to menses. Prior to your menses, you go down there, you constrict the blood vessels when you go down in the ice, and the blood is spout out of there, and congestion is lesser. And if the blood vessels are sort of constricted, there's not a lot of flow of blood into your endometriotic tissue, and they die off or they don't grow, and then you have lesser pain and lesser inflammation and pain in the area. So we have supplements also. You remember the supplements that I said earlier, you got to work on that. Now, the supplements, you have the adaptogen, right? You have ashwagandha, you have dong quai. They sort of help your help your, what they call this, your endocrine system and help your reproductive hormonal patterns there. Then you have anti-inflammatory agents like omega-3, okay? Omega-3s, very rich in flaxseed, even in your soy products. If you could get your soy, you can get them the little seeds like chia. But they found out that there's omega-3 in those little seeds, flaxseed and and chia. And you can also get it from, what do you call this? You can also get it from seaweed, okay? Those that don't like seaweed, but seaweed is very rich in omega-3. Okay, so supplements such as that, anti-inflammatory. Then you can also use turmeric. Okay, turmeric is very strongly anti-inflammatory. Turmeric, ginger, and I always say that you can call me Dr. Turmeric or Dr. Ginger. I don't care, because turmeric is one of the strongest anti-inflammatory herb that is out there, spice that is out there. It's really strongly anti-inflammatory. So turmeric is one of them. Then you have immune supportives. You don't regularly use these immune supportives because they can be problematic if you take it in a long term, such as golden seal, licorice. They're strongly immune enhancing and help you. They're almost like adaptogens, but not quite there. You can use these supplements. And then you can help your liver. Okay? You have adaptogens, you have anti-inflammatory agents, you have immune supportives, and liver supportive herbs. The liver supportive herbs are milk thistle, and then you have NAC, N-acetylcysteine, and glutathione. Okay? So, but I'm not pushing glutathione, and I probably will push a little bit of milk thistle and or dandelion and or NAC, but not NAC because it's an extract already. So I'd rather that you go to the plant, like you get your milk thistle plant, you get your dandelion plant, and you get your liver support in those things. Then you can also have your vitamins and minerals, magnesium, calcium, zinc, and vitamin D. You want to have this in your diet and in your lifestyle. Make sure you pick these things up because these things make your immune system better, give you boosting in your body, helps your body work better, and helps also your HPO axis. So these are things you always take into consideration. They may be really good for endometriosis, but they can also be good for the rest of the other problems that you have. So we're going to go to one subtopic in this presentation, which we have adenomyosis. Okay? Adenomyosis is the presence of endometrial tissue within the uterine muscle. So it is endometriosis, but not outside here in your pelvis, but inside your uterine muscle. Can you see these implants here? This is adenomyosis. And the uterus becomes boggy. So when it swells around the menstrual time and becomes heavy, okay? So then the uterus becomes boggy, painful, and heavy on your pelvis. So it's like heavy on your pelvic floor and on your rectum and your bladder. It's commonly seen in older women. Also seen more in high parity women because they give birth, their uterus lacks already. Is already tired. It's not well contracted. And so it is common in high parity women and women who have had uterine surgeries. Okay, so you push the endometrium into the muscle when you have C-section or myomectomy, things like that. Just like endometriosis, it becomes severe as time goes on because it grows and then release blood and then cause irritations there. And then it gives birth because the cells divide. Because when endometrium divides and grows during the estrogen is being released in the first half of your ovarian cycle or your menstrual cycle. So treatment is symptomatic and supportive. It's unfortunately, you cannot do anything but remove the uterus from there. Or take drugs to kill that one or to help you from not having menses. But you don't want that, especially if you want to get pregnant. Definitive treatment involves really the removal of the uterus. And this depends on being able to manage the symptoms or whether there is the desire for childbearing. So if that happens, you decide whether you're going to take it out or not, adenomyosis. It's good that adenomyosis is commonly seen in older women. And endometriosis is seen from 30 and above, although you can see it even in 20-ish years old, right? You can even see in the 20-ish years old. But Adenomyosis is in the later life. So even if they take out the uterus, at least she had done childbearing already. So we come to, I want to share this slide with you. Very big reasons why husbands should love their wives. this is something I came across, and I could not hold myself. I just need to share it. Okay, very big reasons why husbands should love. The husbands don't have menstrual cycles. They don't have menstrual cycles. But the wives go through this bleeding every month until they menopause, and then they become menopause, and they have problems even some more. So why shouldn't the husbands love their wives? They should, because there is a funny coincidence. Woman has man in it. Mrs. has Mr. in it. Female has male in it. She has he in it. Madam has Adam in it. Can you see the funny coincidence? Ever noticed how women's problems start with men? Okay. Mental illness, mental breakdown. Menstrual cramps, menopause. And when you have big problem, it's gynecologist. And when you have the real problem, it's a hysterectomy. Isn't that funny? I really like this one. I don't want to blame my husband. I'm not blaming manhood. I love my husband. I love my son. I love my men friends. God is good. He made Adam to do something for us in this world. But isn't this funny? I like this thing. I always share this one because it's funny. I really like sharing the verse found in the Bible, Exodus 15:26. This is a big promise that the Lord gave to the Egyptians. And I open it to show here on Strong's Concordance on our slide. And it says, and said, the Lord is the one said, if thou wilt diligently hearken. Okay, what does that mean? Hearken is the word shama. It means to obey, to attentively call, certainly consent, consider, to be content, declare, diligently discern, give ear, indeed, listen, obedient, obey, perceive, publish, regard, report, show, tell, understand. If thou wilt hearken, that's what the Bible says. If thou wilt hearken, hearken is not only heart here and no more. It's that obey, declare, like it is your life. Your life depends on it. If thou wilt diligently hearken to the voice of the Lord thy God, and wilt do that which is right in his sight, and wilt give ear to his commandments, and keep all his statutes. It said here, if you will do that which is right in the sight of God, you will give ear to his commandments, you will keep his laws and his statutes, I will put none of these diseases upon thee, which I have brought upon the Egyptians, for I am the Lord that heareth thee. I love this thing. I always go to this thing, Lord, you said that if I'll do this, you'll do this. So the Lord does not lie. When he says something, it happens. So I claim this promise. I'm going to obey, Lord. So what are these diseases the Egyptians did? Okay? The diseases of the early Egyptians in Jama. Okay, they had this in June 13, 2012. It says here, on several occasions, we have referred to the interesting studies on the pathology of ancient Egypt, as disclosed by the studies of mummies and skeletons from tombs and excavations. And one of them there is malignant disease. Okay? And it could be women's problems, or if they're women's problems or not. We know that if we have malignancies, if we have stress, if we have all these problems that women have problems with, God says, if you take into consideration, if you seriously take my word, if you obey my word, if you proclaim my word, if you consider my word, I will not give you the diseases of the Egyptians. So we talk about women's problems, right? And if we do what the Lord wants us to do, these problems, the Lord says, I'm taking them away from you. And I pray, my dear sisters, my dear families that are within my voice hearing, I pray that you take into consideration how God is faithful, how his promises are true. So we don't need to be desperately ending our life and sulking because we have problems. Because, yeah, God is faithful. He says, if you follow, if you do these things, I will not give you the diseases of the Egyptians. I trust that we have learned something here. And I ask the Lord to be with you, my sisters, that may be suffering or can help people from suffering by sharing these videos. We ask the Lord to bless us. Shall we bow our heads? Gracious, loving Lord, our master, our guide, our companion in every trial that we have. We know you're there with us all the time. You want the best for us. You want us to be in health even as our souls prosper. Father, you're gracious. Father, you're merciful. My heart is full when I think about how gracious you are. How unworthy you are, but we are worthy, right, Lord? We are, because you came down through your Son. Your Son shed his blood. I can come boldly before you and ask for what I need in time of need, because you are there for me and you will answer according to your will and grace. We put everything in your almighty physician's hand, Lord, for all our trials in our lives, health-wise or spiritual-wise. You are there. You will keep our names in the book of life for Jesus' sake. Amen. Amen.